Okay, welcome to the deep dive. Today, we are plunging into a topic that, well, every pet owner, especially if you have a dog, really needs to understand.
Hmm.
It's a potentially serious illness for our furry friends, and crucially, it's something that can affect us humans too. We're talking about leptospirosis.
That's right. And we've got a really comprehensive source to work with here. It's a deep overview focused specifically on pets.
So our mission today is pretty clear. Cut through all the complexity and pull out the most important bits of information. What is leptospirosis?
Right.
How do pets even get it?
Yeah.
What signs should you be looking for?
Yeah.
How do vets actually figure this out and treat it? And maybe the biggest one, how do we prevent it? Protect our pets and ourselves.
Yeah, because as you'll definitely see as we talk, this disease can be, well, it can be complicated and it moves fast. So having this info is like your best defense.
Absolutely.
Yeah.
So let's start right at the beginning. What are we actually dealing with here? What is leptospirosis?
Okay, so at its core, leptospirosis is caused by bacteria. Specifically, these little spiral-shaped bacteria, they belong to the genus Leptospira.
And this isn't just a dog disease, right? I hear that sometimes, but it's broader.
Oh, not at all. It affects a huge range of animals. Think livestock, wildlife, rodents. Rodents are really important carriers, actually. And yes, it affects humans. That makes it what we call a zoonotic disease.
Meaning it can pass between animals and people. Got it.
Exactly.
And in the pet world, our source really zooms in on dogs. Why the big focus there?
Well, dogs can get some really severe forms of leptospirosis. Plus, they're close contact with us, living in our homes. That makes the zoonotic risk, the risk to humans, a pretty significant public health concern.
Right.
Cats can technically get it, but it seems much less common. And when they do, they often have milder signs, or maybe no signs at all. They might act more like silent carriers sometimes.
Interesting distinction. And where are we most likely to run into this bacteria? Is it everywhere?
It's found basically worldwide, but it definitely prefers warm, humid climates, especially places that get a lot of rain.
Okay.
Think areas with standing water puddles, ponds, slow-moving streams, particularly if you also have a lot of wildlife or rodent activity nearby. Those wet environments are just perfect for the bacteria, which get shed in urine.
Okay, let's unpack that transmission piece. How do pets actually get infected? If it's coming from animal urine, how does it, make the jump to my dog?
Right. So the main way is through contact with a contaminated environment. An infected animal, especially rodents, they're major shedders, passes huge numbers of these bacteria in their urine.
Yeah.
That urine then contaminates the soil, the water, maybe even food sources left outside. So a pet gets infected either by direct contact with that infected urine, maybe sniffing it, licking it.
Unlikely, but possible.
Yeah, or much more commonly, indirectly.
Indirectly, meaning just being near it.
Meaning things like drinking, swimming, or even just wading through water that's been contaminated by infected urine. Puddles after rain are a classic example.
And how does the bacteria actually get into their system then? Just by swallowing it?
Swallowing contaminated water is one way, yeah. But it's surprisingly good at getting in other ways, too. It can penetrate right through mucous membranes, so the moist tissues lining the eyes, the nose, the mouth.
Wow.
Or it can get in through broken skin, even tiny little cuts or scrapes, say, on their paws. So imagine a dog splashing through a contaminated puddle, maybe has a small nick on its foot. That's an entry point.
And you keep mentioning rodents. They're a really big piece of this puzzle.
They are absolutely key reservoirs. Rodents often carry the bacteria without getting sick themselves, right? But they're constantly shedding it in their urine.
Oh, okay.
So areas with lots of rats, mice, that kind of thing, or places where pets might encounter their urine under decks, near garbage cans, those are higher risk zones.
And our source mentioned there isn't just one single type of this Leptospira bacteria.
Exactly. There are actually over 250 different varieties, we call them serovars, that can potentially cause disease.
150.
Yeah, quite a few. And while some might have preferred hosts, like one type maybe likes dogs more, another likes cows, they're pretty adaptable. Cross-species infection is really common.
Okay.
And knowing about these different types, these serovars, is important because our vaccines are designed to protect against the most common ones we see causing problems in dogs. Like Canicula, Icterahemorrhagiae, Grippotyphosa, and Pomona. Those are the big four usually targeted.
Okay, now here's where it gets, I think, really tricky and maybe confusing for pet owners.
Yeah.
The symptoms.
Mm-hmm.
Our source makes it super clear they can be incredibly varied.
Oh, they truly are. That's one of the biggest challenges with lepto. It can present in such a huge range of ways. It could be so mild you barely notice anything's wrong, or it could be sudden, severe, and absolutely life-threatening.
And there's usually a delay, right,
Yeah.
between when they're exposed and when they actually start showing signs.
Yeah, typically an incubation period of about, say, 4 to 12 days, sometimes a bit longer, sometimes shorter. But yeah, a dog could have picked it up a week or more before they seem sick.
So let's talk specifics. What might those first signs look like? The things an owner might notice initially.
Often it starts really vague. Things that could be, well, almost anything. A fever. Maybe they just seem really tired, lethargic.
Not themselves.
Exactly. Not eating well, maybe some vomiting or diarrhea. They might look a bit dehydrated, or you might notice shivering, which could be from muscle soreness or fever. But none of those scream lepto on their own.
Right. Could be a stomach bug or something else entirely. Then it can start hitting specific organs.
Yes, and this is where it often gets much more serious. The kidneys are a major target.
Okay.
So you might see increased thirst and urination at first, as the kidneys are trying really hard to flush things out. But then in more severe cases, the kidneys can start to fail, leading to acute kidney injury. And then you might see the opposite, decreased urination, or sometimes none at all.
That sounds bad.
It is. And the liver is also very commonly involved.
What does that look like?
A key sign there is often jaundice. That's a yellowing you might notice in the gums, or the whites of the eyes, sometimes even the skin.
Okay.
Blood tests would show problems too, elevated liver enzymes. High bilirubin levels, basically telling us the liver is inflamed and struggling. In bad cases, this can progress to hepatitis or even outright liver failure.
Wow. And the source material also listed some other, maybe less common, but still really serious possibilities.
Right. You can sometimes see respiratory problems like coughing or difficulty breathing. Sometimes that's linked to bleeding within the lungs, which is very serious.
Bleeding?
Yeah, bleeding disorders themselves can be a sign. Look for things like tiny pinpoint red spots called petechiae on the skin or gums or nosebleeds. Or finding dark tarry stool, which indicates bleeding inside the digestive tract. Some dogs might also show signs of abdominal pain, eye inflammation, uveitis, and though it's rare, neurological signs like seeming unsteady on their feet or even seizures.
Man, that is a huge, huge spectrum. It really sounds like the specific signs and just how sick a dog gets can really vary depending on, well, what factors influence that.
Several things. The specific serovar, the actual strain of Leptospira involved, plays a role. Also, the individual dog's immune system, how well can it fight back? And then, crucially, how quickly does the owner seek veterinary care and how fast does treatment begin? Time is really of the essence.
Okay, so with symptoms that are just all over the map like that, how on earth do vets accurately diagnose this thing? It seems like it could be mistaken for, I don't know, a dozen other conditions.
You've absolutely hit on the key challenge right there. Because those symptoms overlap with so many other diseases, kidney disease from other causes, liver problems, pancreatitis, even some poisonings,
Right.
you absolutely must do specific testing to confirm leptospirosis. You just can't rely on the symptoms alone. A vet might strongly suspect it, but you need tests.
So walk us through that process. What happens?
Well, it usually starts with the vet getting suspicious based on the clinical signs, especially if they see that combination of acute kidney or liver problems. And they'll ask about the dog's history. Has the dog been swimming recently? Does it hike in wet areas? Are there rodents around the property? Any potential exposure?
So getting the backstory, then the lab work starts.
Exactly. The detective work really kicks in with blood and urine tests. Routine stuff first, like a CBC, a complete blood count, which might show changes in white cells, platelets, maybe anemia.
All right.
Then a serum chemistry panel, that's where you'd see those high kidney values, the BUN and creatinine, or the high liver enzymes like ALT and ALP and high bilirubin if the liver is involved.
And urine tests.
Hair analysis, yeah.
Yeah.
That can show things like protein in the urine, signs of inflammation, maybe even blood. So these general tests tell the vet, okay, something serious is wrong, likely affecting the kidneys and the or liver.
But it still doesn't prove it's lepto, right?
Oh, yeah.
So what are the specific tests for it?
Correct. To nail down the diagnosis, you need leptospecific tests. The main one, often called the gold standard for confirming an active infection, is the microscopic agglutination test, the EMET.
Okay, MAT. How does that work? What's it looking for?
The EMAT test looks for antibodies in the dog's blood. It's measuring the immune system's response to the bacteria.
Oh, okay.
But here's the catch. Just finding antibodies doesn't always mean the dog is sick right now. It could mean they were exposed in the past, or even vaccinated. So to really diagnose an active, current infection with MAT, you often need to do the test twice.
Twice. Why?
You take an initial sample and then another one maybe 1 to 3 weeks later. What the vet is looking for is a significant rise in the antibody level between those two samples. We call that a rising titer. That increase tells you the body is actively fighting off a current infection right now.
Got it. So that rising number is key for Matt. What about the PCR test? I feel like I hear about PCR for everything now.
Yeah, PCR is definitely useful here too. PCR tests look for the bacteria's actual DNA, the genetic material in the blood or urine. Okay.
Its big advantage is that it can be positive very early in the infection, sometimes even before the dog's body has had time to produce enough antibodies for the Matt test to pick up.
So they're useful at different times.
Kind of. Think of Matt looking for the immune response, the fight, and PCR looking for the invader itself, the bacteria's DNA. PCR is often better really early. Matt is better for confirmation a bit later, especially with that rising titer.
Makes sense. Are there any other tests used?
There are some other antibody tests like ELISA assays, but they tend to be a bit less specific than the Matt for pinpointing the exact serovar and actually trying to grow the bacteria in the lab, culture it. That's technically possible, but it's rarely done clinically because it's very difficult, slow, and needs special labs.
Okay, so given how serious this can be and the need for these specific tests, which might take time, what does treatment actually look like and how quickly does it need to start? You said time was critical. Prompt, aggressive action is absolutely vital. Non-negotiable, really. Because the disease can progress so quickly and cause severe organ damage, vets often have to start treatment based on a strong suspicion, even before those definitive test results like the F are back.
So treat first, confirm later if necessary.
In many cases, yes. Waiting for full confirmation could unfortunately be fatal or lead to much worse outcomes.
Wow. Okay, so what does that intensive treatment actually involve?
It's usually a multi-pronged approach. First and foremost is supportive care, especially if the kidneys are hit hard. This means aggressive intravenous BOFI fluid therapy, lots of fluids.
Why so much fluid?
To combat dehydration, help flush toxins through the kidneys, support kidney function, and correct any electrolyte imbalances, which are common. Then you need medications to control symptoms like vomiting antiemetics and drugs to protect the stomach lining called gastroprotectants. Nutritional support is also crucial if the dog isn't eating. Sometimes that means appetite stimulants, or even placing a temporary feeding tube. And pain management might be needed if there's significant muscle pain or abdominal discomfort.
Right. And then you have to actually fight the bacteria itself, presumably with antibiotics.
Exactly. Antibiotic therapy is the other key component.
Is there a standard antibiotic, like a go-to choice?
Doxycycline is generally the preferred antibiotic for leptospirosis.
And why doxycycline specifically?
Well, it's effective at killing the bacteria, obviously, but maybe just as importantly, doxycycline is particularly good at clearing the bacteria from the kidneys. That's where lepto tends to sort of hide out and can lead to long-term shedding in the urine, even after the dog feels better.
So it helps stop them from spreading it later.
Precisely. It significantly reduces that risk of the dog remaining a carrier and shedding bacteria. It's typically given for about 2 weeks.
Are other antibiotics ever used?
Sometimes, yeah. Especially in the very initial acute phase, when the bacteria might still be circulating widely in the bloodstream, an antibiotic like penicillin or ampicillin might be given intravenously first. These can quickly knock down the bacteria in the blood.
Okay.
Then the vet would typically follow that up with the course of doxycycline to really target the bacteria hiding in the tissues, like the kidneys, and prevent that shedding. Sometimes amoxicillin clavulanate is used as an alternative if doxycycline can't be used for some reason, so it can sometimes be like a 1-2 punch strategy with the antibiotics.
And you mentioned severe cases often need hospitalization.
Almost always. Dogs showing severe signs, especially that acute kidney injury, need intensive care in the hospital. This isn't usually something you can manage at home. It might mean days, sometimes even weeks of hospitalization.
Wow.
And during that time, it's crucial to monitor them really closely. Daily blood tests to check their kidney and liver values, meticulous tracking of how much urine they're producing. It's very intensive nursing care.
So turning to the prognosis then, the outcome. What does that picture generally look like for a dog that gets diagnosed with lepto?
It really, really depends. The two biggest factors are how severe the illness is when it's first diagnosed and how quickly that aggressive treatment we just talked about is started.
So catching it early and hitting it hard makes a difference.
A huge difference. With prompt and intensive veterinary care, many dogs can make a full recovery.
That's good news. But is recovery always like a clean slate? No lingering effects?
Unfortunately, no, not always.
Yeah.
Even dogs that survive the acute illness, some may end up with permanent kidney damage or, less commonly, liver damage as a long-term consequence of the infection.
So lifelong management might be needed in some cases.
Potentially, yes, depending on the extent of the damage.
And what about for those really severe presentations you mentioned earlier?
Yeah, for dogs that develop really serious complications like complete acute kidney failure requiring dialysis or that severe bleeding in the lungs, or a condition called DIC, which is a widespread clotting problem, for those cases, the prognosis is much more guarded to poor, even with intensive care.
That's tough. And you mentioned something earlier that feels really important here too. Even after they recover, there's still a risk.
Yes, this is a critical point to understand. Dogs that survive leptospirosis can continue to shed the bacteria in their urine for weeks or sometimes even months after they seem clinically recovered.
Even if they look totally fine.
Even if they look totally fine, this means they can still pose a transmission risk to other animals and to humans during that shedding period.
Which brings us squarely to that really important question. What about the risk to us? To the people living with the dog?
Absolutely. We established it's zoonotic, right? So yes, infected pets, particularly dogs, because of their close contact and potential for severe disease, can absolutely transmit the Leptospira bacteria to humans.
Okay, that's definitely something people need to know.
For sure. And it's why taking precautions when dealing with a suspected or confirmed case of lepto is so incredibly important. Not just for vets and their staff, but for owners at home too.
So what kind of precautions are we talking about? Just washing hands?
Hand washing is crucial, yes, but it goes beyond that. Strict hygiene is really non-negotiable. Anyone handling the pet, cleaning up after them, handling their bedding, or anything that might be contaminated with urine
Right.
should wear disposable gloves at a minimum. Maybe even protective clothing like a gown if there's a lot of potential contact. Surfaces that might have urine on them need to be thoroughly cleaned and disinfected with something effective against bacteria.
Like a bleach solution.
Bleach solutions work, many standard veterinary disinfectants too. The key is avoiding direct contact with the urine itself. In a vet hospital setting, infected animals are typically kept in isolation to minimize the exposure risk to staff and other patients.
So it sounds like owner education on this specific point is really, really key.
Fundamentally important. Pet owners absolutely need to be made aware of this zoonotic risk. They need to understand how it's transmitted through the urine and know exactly what hygiene practices they need to follow to protect themselves and their families while their pet is sick, and importantly, during that potential shedding period after recovery too.
Okay, stepping back then from treatment and risk, what are our best shots at preventing this whole scenario from even happening in the first place? How do we stop pets from getting lepto?
Prevention is definitely the goal, and it's usually a multi-pronged strategy. Vaccination is a really important cornerstone.
There are vaccines for lepto in dogs.
Yes, absolutely. And they are considered a core vaccine in many areas, especially regions where leptospirosis is known to be prevalent. Your vet would recommend it based on your local risk.
And what exactly do these vaccines protect against? You mentioned all those serovars earlier.
Right. Most of the modern vaccines available today cover the four most common serovars that tend to cause disease in dogs, those ones we mentioned: Canicola, icterohemorrhagia, cryptotyphosa, and Pomona. That's why you often hear them called L4 vaccines.
Okay, L4 for the 4 types. And what's the actual benefit? Does the vaccine completely stop them from ever getting infected?
That's a great question. The vaccine doesn't necessarily prevent infection entirely in every single dog that gets exposed. You can still sometimes get a breakthrough infection.
Okay.
But UT, and this is a huge benefit, vaccination significantly reduces the severity of the disease if a dog does get exposed. So instead of getting critically ill, they might only get mild signs, or maybe none at all.
That's still a big win.
A massive win. And critically, vaccination also greatly reduces the amount of bacteria the vaccinated dog sheds in their urine if they do get infected. This minimizes their potential to spread it to other animals or people, so think of it as taking the punch out of the disease and reducing the spread.
Makes sense. What's the typical vaccination schedule look like for this?
Usually, after the initial puppy series, which might start around 8 to 12 weeks old, with a booster shot 2 to 4 weeks after that, it requires an annual booster vaccination to maintain that protective immunity.
Okay, so annual boosters. What else besides vaccination?
Environmental control is the other big piece. This basically means trying to limit your dog's exposure to high-risk environments.
Like avoiding certain places.
Yeah, pretty much. Try to avoid letting your dog drink from or swim in stagnant water sources. Think puddles, ponds, slow-moving creeks or ditches, especially after heavy rainfall or in areas where you know there's a lot of wildlife or potential rodent activity.
So maybe skip the murky pond swim.
Probably a good idea in endemic areas, yeah. Also, trying to control rodent populations around your own property can help reduce a major source of contamination. And simple things, like if your dog urinates in your yard, cleaning it up reasonably quickly can help minimize bacteria buildup in the soil. Also, generally avoiding contact with wildlife reservoirs if possible.
But I'm guessing owner education pops up again here.
A huge role, absolutely. Vets really need to talk to their clients about the local risks of lepto, what the signs look like, and the importance of vaccination. This is especially crucial for dogs that have lifestyles putting them at higher risk. Dogs that are very active outdoors, go hiking or camping, swim in natural water sources, or live in areas with significant wildlife or rodent exposure.
So understanding your own dog's risk factors is key.
Exactly. It allows owners to make informed decisions about their pet's preventative care plan.
So if we try to connect all these threads, bring it all together, leptospirosis is clearly a serious, potentially fatal disease in dogs. And those signs can be super misleading, right?
Absolutely. Which means vets need to keep a high level of suspicion, especially with kidney or liver issues, and owners need to be aware of the risks and the potential signs.
And while, yes, early diagnosis and really aggressive treatment can significantly improve the outcome.
Prevention really is the name of the game here. It's so much better to avoid it if you can.
Especially when you factor in that zoonotic angle, managing this disease effectively in our pets is also a direct public health action. It protects people too.
Definitely. Vaccination, smart environmental control, good hygiene, and just being educated about it, those are really our most powerful tools for reducing the risk for both our pets and ourselves.
So to recap our deep dive today, we've explored leptospirosis, what it is, this bacterial infection spread through contaminated environments, often urine from reservoir animals like rodents. We talked about how tricky the symptoms can be, ranging from barely noticeable to sudden and life-threatening, hitting the kidneys and liver hard.
And the detective work needed for diagnosis, using specific tests like MMAT and PCR.
Right. And the absolute critical importance of acting fast with treatment supportive care, antibiotics like doxycycline. We touched on the variable prognosis, the potential for long-term issues, and that risk of shedding even after recovery.
And the zoonotic risk, the need for careful hygiene.
Exactly. And finally, how prevention through vaccination, being smart about high-risk environments and just knowing the facts is so crucial for both pet health and human health.
Understanding all these pieces really allows you, as a pet owner, to partner effectively with your vet and be proactive in managing this potential threat.
Couldn't agree more. Which leads to maybe a final thought. Considering all those potential exposure risks we talked about, puddles on a daily walk, maybe a dip in the local pond, wildlife potentially passing through the backyard, how might rethinking your pet's regular outdoor routine or even their environment be just as critical to their overall preventative care plan as simply making sure they get that annual vaccination shot?
That's a really worthwhile consideration, something for every pet owner to think about in their own specific situation.